Effects of hormonal imbalance on women's health. Hormonal imbalances may be to blame for a range of unwanted symptoms from fatigue, or weight gain to itchy skin or low mood. Hormones are chemicals produced by glands in the endocrine system and released into the bloodstream. An imbalance occurs when there is too much or too little of a hormone. A hormonal imbalance happens when you have too much or too little of one or more hormones. Your body's chemical messengers. It's a broad term that can represent many different hormone-related conditions. Many hormones can affect how your body signals that you need food, and how your body uses energy. So an imbalance of certain hormones can result in weight gain in the form of fat storage. For example, excess cortisol, a hormone, and low thyroid hormones, hyperthyroidism, can contribute to obesity. Additionally, improving dietary choices, increasing physical activity, getting more sleep, managing stress levels effectively, quitting smoking, and limiting alcohol are all ways to decrease and avoid hormonal weight gain. Both men and women can develop hormonal imbalances that can cause hair to thin or fall out. Often, treating the imbalance helps your hair regrow. Although most people think of estrogen or testosterone when they think of a hormone imbalance, issues with your thyroid can also lead to hair thinning. As with male pattern baldness, female pattern baldness comes from hormone imbalances, specifically dihydrotestosterone imbalances, or DHT. This hormone is similar in structure to testosterone, but it is significantly more potent. DHT can attach to receptors on the hair follicles, causing the follicle to shrink. Hormonal imbalance can be a major cause of loss of libido. For many men and women, low libido is most commonly experienced in premenopause, menopause, and andropause between the ages of 40 and 55. For most women, hormones are at the heart of a lackluster libido. In fact, hormonal imbalances are the cause of 70% of low libido cases. Our hormones change as we age, especially during premenopause and menopause. Hormones are constantly changing, and when they do, your libido changes too. Hormone changes related to reproductive hormones, like estrogen and progesterone, can cause unpleasant changes in your body temperature that make you feel too hot. Your body may respond with a hot flash to cool down, or you may sweat excessively. Night sweat. The thyroid can produce too much fluctuations of estrogen, progesterone, and testosterone can cause zits and pimples to pop up. Typically, these fluctuations happen mostly during menstruation cycles, pregnancy, and menopause. During these times of increased hormones, the body produces more sebum, an oily, waxy substance. Hormonal imbalances are the leading cause of infertility in women. Disorders like polycystic ovary syndrome, PCOS, and anovulation can be the result of a hormone imbalance in women. Men may also experience hormonal disorders that affect their fertility, such as low testosterone levels. Specific hormone-related conditions that cause irregular periods include polycystic ovary syndrome, PCOS, and amenorrhea. Infertility. Hormonal imbalances are the leading cause of infertility in people assigned female at birth. Hormone-related conditions such as PCOS and anovulation can cause infertility. Anxiety can be caused by an imbalance in two key hormones, serotonin and cortisol. Imbalances of these important chemical messengers disrupt the brain chemistry and nervous system, which regulate our moods, stress levels, and emotions. Fluctuating levels of estrogen and testosterone, which are considered sex hormones, may play a role in how much anxiety you experience. Changing levels of these hormones can affect your mood. This is why anxiety sometimes peaks during times of hormonal change, such as puberty, menstruation, pregnancy, and menopause. In women, fluctuating hormone levels are a major contributing factor in chronic headaches and menstrual migraines. Hormone levels change during the menstrual cycle, pregnancy, and menopause, and are also affected by oral contraceptives and hormone replacement therapies. PCOD is a condition in which ovaries produce many immature or partially mature eggs. This happened due to poor lifestyle, obesity, stress and hormonal imbalance. PCOS is a metabolic disorder and more severe form of PCD can lead to anovulation where ovaries stop releasing eggs, raised levels of luteinizing hormone LH. This stimulates ovulation, but may have an abnormal effect on the ovaries if levels are too high.